Hello, it's Dr. Eric Perman from Summit Dental Care here in Twin Falls, Idaho. One of the questions that we've been getting a lot and actually been seeing a little bit more prevalent in our practice today is, what are the effects of vaping or e-cigarettes on my oral health? It's kind of was a new trend that started a while ago, and so the science was a little bit unclear, but over time we're starting to see that there's some things that are concerning to us, and we're trying to raise the alarm out there for people to know and understand. But I think they got a lot of the young population into this trend by adding flavors to e-cigarettes or vaping. And they did this by sweetening the flavors by adding sugar, sucralose, and other artificial sweeteners, thereby making it more attractive to a lot of the younger population. But they don't tell you about some of the other chemicals that are in the vaping vapors, which are propylene glycol, benzene, formaldehyde, and also nicotine, which is the one that really people get addicted to. And so some of the effects of these drugs, obviously we know that nicotine is a vasoconstrictor, and so it constricts the blood flow to the oral cavity, thereby decreasing the amount of saliva that's made in the mouth, decreasing the immune response to bacterial invasion of the mouth. And by doing these things, we're basically taking down a lot of the mouth's defenses at fighting these things that the mouth has to go through every day. And so we're seeing that those people that are vaping or using e-cigarettes on a pretty frequent basis, we're seeing a high correlation with younger periodontal disease, where their tissues and their bone levels around their teeth are starting to diminish and their teeth are getting more wobbly and loose. And we're also seeing a higher prevalence of smooth surface caries, probably due to some of that sweetening that's in the flavors of the e-cigarettes. So as I mentioned, we see a higher prevalence of periodontal disease in younger patients, where their bone levels start to decrease and their tissues get really inflamed and red and sore. The teeth are getting loose and wiggly and they're losing them. And then also the other effect is we're seeing the smooth surface cavities, which are cavities that are kind of on the part of the tooth that you can see when you smile. And so they're on the areas of the teeth that are most visible. And so patients' confidence is going down because they're having these big black or brown spots on the front of their teeth that most people see when they're talking or smiling. And so that's concerning to us, not only for an emotional standpoint, but also for a biological standpoint in their overall health. And right now, they're just starting to scratch the surface with some of these other chemicals that are in vaping. So if you value your oral health, we can't recommend vaping or e-cigarettes. So please don't hesitate to give us a call here at Summit Dental Care if you have any questions regarding e-cigarettes or vaping. We'd love to answer those and help you get the oral health that you want and we know you deserve.